Thanks, Megan. I see that Megan is working the chat already. So you've been invited to let us know who you are and where you're from, what program you're with. We're really thrilled to have those of you who are able to make it today. We're middle of December to this pop-up webinar that we're having. I'm going to go ahead and get started. So good afternoon. My name, or possibly morning for you. Good afternoon for me. I'm on the East Coast. This is a special webinar where we're going to talk about the Aquifer adoption and use self-assessment. We've called this webinar Unlocking Aquifer's Full Potential because that is our goal. My name is Joe Miller. I'm Aquifer's Curriculum Integration Specialist. That means that I support programs and educators to get the most out of Aquifer's content, including supporting the integration of Aquifer into the curriculum and the development and implementation of effective educator resources. Today, I plan to share on how a team of healthcare educators collaborated to craft an adoption and use framework and the accompanying self-assessment tool that we're going to share with you today. I'll share how the tool works, how to maximize this tool for planning, and related recommendations and resources. Before we get started, a couple of housekeeping things, and you guys will let me know if this doesn't work for you, and Megan will help out through the chat. One is that if you need closed captioning, I believe there is a keyboard near the bottom of your screen that should activate closed captioning. And then if you need to change the slides, the size of the slides, you can do that in the upper right-hand portion of the screen. That should give you a zoom in, zoom out capabilities. And then if you have any questions, you can either drop those into the Q&A or you can put them in the chat and we'll make sure that those get elevated. So we encourage you to ask questions as we go along. All righty, so let's go ahead and get started. All right, so in today's session, I aim to achieve 3 key objectives. I'm going to start with a comprehensive background on how and why the adoption and use self-assessment was developed. I'm going to begin by discussing the problem this tool intends to solve. I will share insights into the collaborative process of these health professions educators, how they worked to create this framework. And I think this is important because this background will help you appreciate the underlying principles and the effort that went into designing the self-assessment tool. And you'll be introduced to some degree to the underlying framework that was used to build the self-assessment. And then I'm going to guide you through the practical aspects of accessing and using the self-assessment. It's pretty straightforward, but I'm going to show it to you and just give you some insights around how it works. This is going to be a step-by-step walkthrough. And then later on, once we've done that, we'll share the links so that you can activate it yourself. And just as a heads up, we always send a follow-up message and you'll have links to the self-assessments if you miss those in today's webinar. So, and I'll talk a little bit about how to navigate it, tips of how to think about it to get the best results out of the assessment as well. And then finally, we're going to discuss the steps that you might take after completing the self-assessment. I'm going to outline how to interpret your results and provide guidance on implementing the recommendations and resources available. This part of the session is important as the idea is that the assessment results will transform into actionable steps for you as a program. And some of that will be collaborating with Aquifer and Aquifer's peer trainers and the resources that we have available to you. It's all about really integration and increasing the effectiveness of the Aquifer learning system in your curriculum. So with that in mind, let me jump right in. So given those 3 parts that I just talked about, I'm going to start with the background and the development. And this is about both the adoption and use framework, that sort of DNA that went into the self-assessment. So starting out, Aquifer is a unique organization because we are a mission-driven nonprofit, and our goal is to deliver the best healthcare education through collaborative development and research into innovative, high-impact virtual teaching and learning methods. In our mission to continuously improve patient care through enhancing clinical education, we have envisioned and have been working towards building a comprehensive learning system. and we intend to have this rounded out within the next couple of years. This system is designed to deliver complete, trusted content and quality formative assessments. By complete and trusted content, we mean covering the entire clinical curriculum, pediatrics, internal medicine, OB/GYN, behavioral health, and more, and even building out the content around the basic sciences that are necessary to do high quality clinical reasoning. We're not 100% of the way there yet, but we are pretty close. And the system also includes formative assessments that launch learners into the master adaptive system. So you can see on the left is a big part of our system is content, and on the right, a big part of that system is formative assessment. And the whole learning system works together to maximize effectiveness for student learning and improve patient care. So in this whole system, when we think about it, is underpinned by meaningful data, which is connected throughout the system. At Aquifer, we don't just want to provide supplemental resources to students and educators, but also coaching and tools that advance the efficacy and efficiency of clinical learning. Despite the comprehensive nature of our system, we've observed a gap in its optimal use. So we have this idea that we're providing a mostly comprehensive system, but we can see that programs, that there are gaps in how it's used and how efficiently and effectively. And part of that is what students have been saying to us. There was a study on Aquifer cases back several years ago, and students said in that, when they were asked, was students think carefully integrating virtual patient cases into the broader curriculum, including eliminating redundant coursework and training faculty to use these, is really important. The students' perceptions of how deliberately the cases are integrated directly impacts their satisfaction and their ultimate learning. The thoughtful integration strategies like providing an orientation, coordinating case content with lectures, training faculty to build on the cases, and eliminating redundant assignments are really important for achieving good learning outcomes with virtual patients. And generally speaking, students do not see assigning Aquifer cases as optional to be integrated into the curriculum. However, when we ask students, they have reported that Aquifer is often used as an optional resource and rarely as part of interactive teaching. In other words, they often feel like it's not as clearly integrated into the curriculum as they would like. Educators also report that Aquifer is being used in similar ways as homework, optional resource, and rarely as part of an overall interactive strategy of teaching and learning. This presents us with two problems. Despite the comprehensive nature of the system we've tried to build, we have observed that these two critical problems exist. First, we observed a gap in its optimal use. And curriculum deans, clerkship directors, and teaching faculty are burdened by their demanding schedules and often do not fully engage with the depth of Aquifer's capabilities. And this has led to this suboptimal adoption because it's really hard to get a full breadth of the system and makes it really difficult to be fully effective with it. And this turns out to affect student satisfaction, and then to some degree, the overall teaching and learning impact is lost as well. And as a mission-driven organization, we want to ensure that our subscribers get the most out of our system because we are fully committed to improving student learning and encouraging safe and effective clinical care. The second big problem is that programs, system leaders, and educators want to implement Aquifer to maximize value because in addition to just wanting better clinical reasoning from their students and better outcomes, they also feel some pressure to use the limited resources that they have available to them in the most effective way possible. And some of that pressure is internal. Some of it comes from their bosses, deans, provosts, and others. And we see and hear both of these issues. And what we'll talk about today is the first step in our effort to support programs, leaders, educators to more effectively use Aquifer to increase student learning and improve patient care. So that takes us to how we got started in trying to solve those problems. And so recognizing the problems I mentioned on the previous slide, a group of dedicated health professions educators tackled this issue head on. So we brought them together and assigned them a goal. And their goal was to redefine the way Aquifer's impact on teaching and learning is measured and utilized. And they met initially for a single day, then once a month for about a year to come to the ultimate goal of creating this self-assessment. And every good project obviously starts with a giant Post-it paper filled with little Post-it notes. And this group was absolutely no exception. They started out by describing what it would look like if the Aquifer learning system had an impact on student learning, educator success, and program success. This effort was aimed at vividly describing the impact, visualizing where we hope students are using our resources. This group dug in and worked on definitions the very first day. So what would impact look like? Once they had an idea of what impact they wanted, they came up, they started to go through the stages of integration, and they said, okay, what would it look like for a program that was using Aquifer for impact? And they defined that end goal. So if you're familiar with backwards-based design, they started with, this is what we want to come out. What does it look like when a program is being really successful at this process? And they defined two broad stages of programs. The first they called adoption, and the second is what they called use. And adoption is the adoption of tools and resources into their system. And use is that the tools are being used effectively to impact student learning. So when you look at the images that I've just shown, it looks like a mess. And frankly, in the early stages of brainstorming, it probably, mostly was, but it also contained the structure that finally emerged. And so over the next several months, this team of healthcare educators that included a couple of deans, program directors, some Aquifer staff, clerkship directors, nurse practitioner, PAs, DO, MDs, all working together over this time. They debated and they came up with what adoption and use could look like to result in impact. And they called this the adoption and use framework. And it really, if you're familiar with rubrics, it ends up looking like a rubric. And on the screen, we're not gonna dig deep into this. You can zoom in or zoom out if you want. We're not gonna go through the rubric in depth because it's very difficult to read and quite detailed. But this is an image from what resulted out of all that work. It describes the progression from early adoption to effective use. So on the previous slide, I said they came up with two stages, adoption and use. And later on, they started thinking about this as a developmental framework of going, okay, this is what it looks like when a program or institution first adopts Aquifer, and they're just learning how to use it effectively, and then showed the development as it got to the point where a program is using Aquifer to maximize efficiency and effectiveness. And of course, anytime you're doing something like this, you smooth over some of the complexities of individual programs. Programs are unique. As my colleague and friend Cindy Lord likes to say, if you've seen one PA program, you've seen one PA program. And I've heard that sentiment repeated about MD programs and DO programs and NP programs as well. So that is, so some of this is being smoothed over. And so the framework is intended to bring out some of the behaviors that can get you to that next developmental stage, but not define every behavior that might be relevant to you. And it's really this first step. It's this first step before we have clear predictive data that tells us more about the programs. Right now, we don't have that, so we're trying to engage programs in thinking about themselves and reflecting. And part of this too was also feedback back into Aquifer. So part of what we were thinking about was like, if a program wants to improve, how is it that we help them? And so we need to know more about the needs of our various subscribers and partners. And so in the end, the framework ended up consisting of what we called domains, and there were 8 of them. And you can see those 8 domains on the screen, and those ranged from vision to assessment integration, They encompassed much more details within, as you saw in that previous rubric. And in those 8 domains, there's a total of 25 competencies that we called sort of program competencies. So each domain has one or more competency within it, and those are fine categories of behavior. So it describes this is what a program that is early adoption in the vision area, this is what they look like, these are their behaviors. And so it allows you to see going from early adoption to effective adoption and so forth. It allows you to see some of that trajectory of behaviors. The 8 domains are listed on the screen. The first 2 domains on the left-hand side, vision and strategy, center really around the program or institution's vision for incorporating Aquifer into their system. So how are they talking about it? How are they communicating? How are they deploying it to students? Curricular teaching and assessment integration refer to how Aquifer is actually woven into the comprehensive curriculum. The teaching strategies, how educators are using it to teach. Are they using it as an active learning strategy or optional? And then the approach to assessment. Is Calibrate, the formative assessment we provide, is it being used and deployed to students to encourage master adaptive learners, or are the programs not using the assessments as part of the full system? And then you can imagine the last several are pretty straightforward. Is professional development being provided to faculty on how to communicate and use the tools effectively? And then student orientation turned out to be kind of an important thing in some of those early learnings about Aquifer, and also was really important to the health professions educators that participated on this team. They kept talking about how students need to know the purpose and students need to be provided with orientation. So it ended up being its own domain. And then the last one is learner use, really how students are using it and interacting with it. And these domains were described independently, but taken together, they roll up into those 4 categories. So we still end up with these 4 categories of early adoption, effective adoption, early use, and effective use. So those are the 4 developmental categories. And actually, I think, Megan, if you can drop into the chat now, we have a handout that describes these. And what you see in the on the screen is what the handout will look like. And it has a paragraph description of each of these levels. And you might see yourself in multiple levels as you start to think about that. And that's okay. We think that's realistic for a program to be a little bit nuanced about how they see themselves in reflection. And also we know these categories aren't perfect, that programs will go through domains at different rates. They may focus on certain areas because of the way they use Aquifer. So early adoption in this this developmental sequence, early adoption involves the supplemental decentralized use of Aquifer to fill gaps, but it's not necessarily fully integrated into the curriculum. The effective adoption leverages Aquifer as a quality resource, but the implementation is, again, still decentralized at the department or clerkship level. Once you cross over into the use part, Aquifer is a more integral resource, and the programs or institutions begin mapping their content or competencies to the educator resource, to the content in Aquifer. So it gets a little more clear, like we want this outcome and we know these cases are going to be valuable. And then at the very end, effective use, what we call effective use, Aquifer is integrated across all years. So starting to use our basic sciences content and also thinking of cases in the preclinical years and it's used as a core resource for achieving competencies. So that connection between the student learning, clinical reasoning is really much clearer and how Aquifer is going to get there. It also includes enhancing educator development and optimizing to optimize these outcomes. These levels progress from variable decentralization towards a more deliberate and evidence-based student-centered integration of Aquifer into the curriculum. The problem, of course, is that this is hard for Aquifer and programs to use this form. So if you think about this form and I tell you, hey, look, what you're trying to do is get to this more centralized or evidence-based student-centered integration, that's a pretty broad recommendation. And so when the working group was done with their work and they said, okay, this is what these 4 categories are, they said, now how will anybody possibly use this? And that's because if you think about 8 domains, 25 competencies, and even these 2 pages with those little bullet points in there, it's sort of hard for you to think about how to apply this to your situation and use Aquifer more effectively. So what the group did was they said, what if we built, initially it started out as a checklist of like, check these boxes and maybe this will tell you something about where you are and where to go next. But they said maybe we could build a self-assessment that allows the program to answer a series of questions about themselves and how they're applying Aquifer. And then from there, they can get recommendations about what to do next. So this framework and self-assessment are intended to help programs reflect on where they are and invest time and resources effectively. But it's also intended to help Aquifer provide effective resources to busy faculty, program directors, clerkship directors in this process. It identifies needs for you. And we also then can start to build a roadmap between what you need and what we build and how we provide that to you. The key message that comes out of this is that this group of educators collaborated on a framework that describes a model for using Aquifer to maximize gain for students, educators, and programs. The self-assessment created is intended to operationalize their work, to make it easy for you to get recommendations and know what to do next. And also hidden in there is also makes it easier for us to identify where we want to invest our resources to provide useful resources, or our time and resources at Aquifer and the peer trainers and other volunteers to select resources to build for you. And so I'm going to go into this next section, and in this part, I'm going to talk about the self-assessment tool. I'm going to show you a little bit of what it looks like. It's very simple. And at the end of that section, I believe Megan will put into the chat a couple of links. We'll also send those links out to you in the follow-up email that will allow you to then take the self-assessment. And we've actually created 2 versions, just so you're aware. We created the initial version we created was from the program perspective or the institution perspective. And the reason we did that initially was because the whole rubric or adoption use framework started out from the perspective that a program would be sort of centralized, thinking about how to get the most out of Aquifer. But as we started to have more conversations with people, we realized, or they gave us the feedback, and even the educators on this group said, a lot of times I'm just doing this within my department or within my clerkship. And so we determined that it would still be useful to provide it at the clerkship level as well, so that you could think about your clerkship. So it's a little bit different. It's slightly shorter. The questions are a little different, but it's built upon the same framework. So to do that, I'll just show you a couple pictures of what it looks like, and then I'll go in here. But this is basically what it looks like, and it gives you a short introduction, tells you how many questions it is, a couple of things, and a caveat. Right at the top, it asks for your name and your email address. And the reason it does that is that I believe both of those are optional. But the reason it does that is because it will email you both how you answered the questions, and it will email you the recommendations. And I'll show you what the recommendations look like here after. We'll actually run through one of these and we'll just see what it looks like when it comes out. And so that's why it asks you for that email. The caveat is that actually our email plugin on our website right now is broken. They're rapidly trying to fix it. So if you were to happen to do it today, it may not email you the results, and you'll want to download the results as it shows you in a moment. So this is why we have you add that in here. And I think it's a really useful piece of information for you to have and connect with. So I'm going to go into the adoption and use for the program. Let me just see. I'm going to change my share so that I can do this. Okay, great. So this is what it looks like. You just saw it in an image of this. You can see in my case, it autofills my name in. It may do that for you as well, depending on where you are. And I'm going to select a few things. We have asked folks to um, indicate the type of institution, because we do believe that over time this is going to be really important. Right now it's generally built, but we also know that our plan over time is to better understand how this can be adapted to various types of programs. So right now we're asking to see what we learn. And then what you can see here is just a series of questions, and there are almost always 4 potential response options in here. And it says, please select the option below that best describes how the Aquifer learning system is viewed within your institution or program. And what's key about this is that we're asking you to respond to this question, but you may look across the answers and go, none of these are really describe it. But the question says best describe it. So sort of think of yourself as close as you can. Even if it's not perfect, do the best job you can putting yourself in here. And we recognize that that will cause problems on some questions for you. And over the course of the 25 questions on the assessment, we believe that a lot of that gets sort of smoothed out, and that you'll get reasonable recommendations. And we did a test in September with about 70 educators, and we got the feedback that we got around that was that it worked reasonably well. And when they got their results and the recommendations, it seemed fairly reasonable for them, even if they had some quibbles with some of the questions. So as you go through, it's just going to give you the green light. And if you are required to answer every question, because this is sort of how it thinks about it. So I'm just going to randomly answer these questions, and then I will stop on a couple here. Please select the option below that best describes where in the curriculum your program institution uses Aquifer content in their curriculum. So it kind of asks you, in this case, it says content minimally in either preclinical or clinical curriculum, primarily as a supplementary resource. So you can see this progression from supplementary to down at the bottom, it's utilizing it as a core learning resource. You can remember what I mentioned about that. And so the assessment as we go down, and again, I'm just going to randomly select this so that we can get to the results portion of this. Um, um, And so far, what we've found is that most people take about 10 minutes to complete this. They've ranged as one of my friends who's a dean has done it twice. And both times she took about 40 minutes to do it. And she has a comprehensive system, and she really wanted to think it through. When this was first designed by the educators that got together and designed this, they initially imagined that that people in the program would get together and talk a little bit about how they were using Aquifer. And sort of as they designed the self-assessment, they realized that probably wasn't going to happen very often. But still, we've deployed it in this way, and most people take about, I think the median time was about 8 minutes or 9 minutes, sorry. So it's in that range of 9 to 10 minutes. So I'm going to submit this down at the bottom here, and we'll just see what comes out of this. And this is the part where I said, if you have put in your email, when our email plugin is fixed, if you put in your email, all of this will be emailed to you. And I'm going to just bump this up a little bit. There's bump this up a little bit. What you can see on here is that it's said, okay, thank you for completing this. And then it's given me in bold the level that I'm at. So it tells me right off the bat, it says, based on how you responded to this, this is the level that we believe you're at. And then it gives a short description of what that is. It characterizes that. Here is one of the things that I would recommend that you download. This is the results of what you just responded to it. So it shows you the questions and how you responded to each of those questions. So that's a great thing to save. And then starts to go into recommendations. So when our email is fixed, this will get emailed to you. But if you do it today, I touched base with them this morning. They were working on it and hoping it would be done today. So if you do it today, it may not get emailed to you, but should be in the future that you'll get your results on this. And I'm going to just reset this for a moment and then go back to go to the next step. So the next and last third part of this conversation is about the results, because this is really core to this process, is that you go through, reflect on how you're using it, and then what you're provided is this set of results based on how you answered the questions. And this was really important for the group of educators that put this together. They said, okay, now that we have given people, like told people where they are in the developmental process, what can we provide them in terms of recommendations and resources? And so that's what comes below here. And you can see it gives you the set of recommendations. And regardless of whether you take a clerkship level, program level, regardless of how you come out, you get typically between, I think it's between 5 and 8 headline recommendations. So this is each of the recommendations. In this case, at the effective adoption, it's telling me to enhance my message, map my curriculum to Aquifer cases, which makes a lot of sense. And then it goes down and gives you just a little bit more description about what you can do. And then in many cases, it also gives you, not just describes what you should do, but then gives you a link to a resource that will help you take that action. So it's recommending a set of actions and then also saying, here's some resources to provide you. And so in this case, the second one down is map your curriculum to the Aquifer cases. One of the resources that we are releasing or services that will come with your subscription starting probably early next year is a mapping service where you provide your learning objectives to us, and then we map them to the Aquifer content for you. We're beta testing that right now, and it's actually working really, really well. And as an early adopter of the adoption use framework, you'll get access to this because you'll get this link right here to be included in the beta. And you'll get in that queue to have your learning objectives mapped as well. But then it gives you detailed links to how to set up a custom course if that's what's being recommended and so forth. So depending on how you answer the questions, it gives you this set of recommendations. And again, this is something right here where you can download these recommendations at the bottom. I recommend you doing that if you take it today, because it's probably not going to get emailed to you. So if you do it today, download the recommendations. You can also download your results up above. Okay, so I'm going to switch back really quick here, and we're going to start to wrap this up. All righty, so going back to the slides really quick. All right, so I went over the recommendations, and I think the last part that we want to wrap up in this conversation is, given that we've provided this set of recommendations and this links to those, one of our big things that we're hoping that folks will do is take the assessment, look at the set of recommendations, and then make a meeting with us. And so we've put a link in the recommendations that'll allow you to directly meet with our team at Aquifer, or possibly a peer trainer if we can get one on board. And I think, Megan, if you have that link, you can schedule, if you can drop that into the chat, you can schedule directly with us on our calendar for 30 minutes and just say, hey, I did the self-assessment, and now I'm ready to have a conversation, because what we'd love to do is talk to you about your self-assessment, some of the things that you'd like to be try doing, and then see how we can provide support in that process. So one of the things you get is this link that'll come with your recommendations, but we've also just dropped it in the chat. Feel free to schedule at any time. And a big part of this is we have a small team right now. It's I think Mimi Otten, who is on the call and introduced herself, and myself from Aquifer's view, but we also have a set of peer trainers, which is a team of 6 educators that we try to bring to these. They're PAs, MPs, MDs, and they are working in the field as clinical educators or as clerkship directors. And in fact, Cindy Lord, I think I saw she was on the call. She's one of them and is really amazing and comes to a lot of these meetings. So we try to get these people involved so that you can talk about your challenges and they can help support you in that process. And so that is bringing me down to the end of what I want to say. And so if you can start to, if you have any questions, now is a good time to think about them. But like the recommendations that we, in terms of call to action, is really this: complete the self-assessment. So if Megan, if you have the self-assessment links, those would be great to drop in. Otherwise, we'll make sure that those get sent to you after in the follow-up email. So completing the self-assessment is great. It gives you those connections to those recommendations. You can download your results. Once you've done those recommendations, make a meeting with us. We would love to talk to you about this and see where we can provide additional support for your effective implementation. This is really, really important to us, both to ensure that you're getting value, but also that we're reaching our mission as a mission-driven nonprofit. And then really the one piece of advice that we've thought about a lot since we started to roll this out a couple months ago with our team is really picking one thing to try, because even 5 recommendations is a lot. So just trying to think about one thing that is really clearly would be helpful in your local conditions. So it could be implementing a new resource like using Calibrate, which is our formative assessment system, or it could just be changing the way you communicate about Aquifer in your curriculum. But choosing one thing and giving it a shot would be what we think would be a really useful first step. All right. So I want to stop now and see if there are any questions. I don't see any coming through. Megan, are there any Q&A? No questions in the Q&A. If there are questions, feel free to drop into the chat, and we'll just take a moment here. No, Faye, I see that you've asked a question there. Right now, there's nothing on our plan to charge for the mapping, and in this early stage, we're beta testing it. So I recommend that if you do the self-assessment and you get the link, that you engage with that now. And we expect to roll it out maybe, right now the testing is going great. We're getting really good results. So probably late January, early February. Also, just my email. You can email me directly if you don't want to schedule a meeting with me using the link that was put in the chat earlier. Joseph.miller@aquifer.org. Thank you, Megan. Happy to answer any questions that you have regarding self-assessment or anything else that you have related to integration or adoption and use. There aren't any more questions. I really appreciate your time and look forward to engaging with you in the near future. Thank you.